Good afternoon, everybody. Happy Friday. This is James Gore here at my house, doing what I can to be a social distancing champion like Bigfoot, and thanking all you for what you've done to be able to flatten the curve in Sonoma County and help us get into a position that we can be smart about how we loosen some of the restrictions, but at the same time do it in line with public health. Earlier this week, we signed a formal attestation, our public health officer, with support of the Board of Supervisors, letters from the hospitals in support that we met the metrics of the state to be able to open into the rest of phase 2. What does that mean? Well, as soon as the green light is hit and the county sends out its update to the shelter-in-place order, we anticipate that we're going to have outdoor seating at restaurants open and available. Childcare will now include summer camps, which is a huge issue for a lot of folks. Drive-in, drive-through religious services, drive-through graduations, drive-in movies like we've seen being proposed by in Cloverdale by the theater and by Catherine Hecht and others. Curbside library delivery and pickup. And we're also a little bit of clarification. Wineries, breweries, craft distilleries can also see people outdoor settings if they comply with the requirements under restaurants by the state, which means that food service is a part of that. So we're doing all this right now. Why? Because shelter in place has worked. But the actions of all of you have been the reason that it has worked. I've had some people try and question me and say it wasn't shelter in place that made this happen. Quite honestly, everything that I've seen from epidemiology and not from just crack newspapers and magazines that try and increase the intensity of this moment show that the shelter in place has worked. It has flattened the curve. We do have surge capacity in our hospital. We do have increased testing capacity at a level of 750 or more per day. We do have contact investigation capability. We've got 75 people now, upwards of 110 in the next week, to be able to track and go after this. And as you've seen in some of the childcare and some of the summer school and kind of other things, summer camp scenarios, the goal with those in opening up is to keep kids in cohorts so that you can track if there's a positive test and then go after it and do testing for the people who've been in contact with those individuals, and then isolation and quarantine to make sure that we're not making at-risk individuals sick with COVID. We have a detailed plan. If you look at the attestation form that was signed and delivered by our health officer to the state, it has 16 different criteria, not just the 7 that the state put up. It has 16 criteria that say, this is the criteria, this is how often we're testing it, this is where we are at now, and if we surge to this level, this is how we're going to respond. This is how we're going to work with California Department of Public Health and locally to do what's needed in that scenario. So I've had a lot of people who've said, open it up, don't open it up. We're with the health officer, we're not. But I'll tell you what, people aren't looking at the actual data, the actual forms, the actual plan that has been submitted. It will increase your confidence in where we are at and where we are going. So a couple quick stats to go over. I want to let you know where we're at. We have reached a level of epidemiological stability of COVID-19 in the county. We still have incoming cases. We've had a surge recently of cases, but we have a relatively low number of cases which our planned mitigation measures are able to quickly contain. Secondly, average positive case rate in Sonoma County has been 2% of all tests, below the state threshold. Testing capacity has been an average before of 476 to 500 per day. We're surging towards the 750 per day with support from the state and OptumServe. We also have a community transmission rate of 0.32 per 10,000 residents. Once again, the community transmission is where we don't know the cases are coming from, and then the contact investigation is where we know that they are coming from. As I said before, we have testing expanding. The state sites have been able to double their capacity. They started off at being able to do 130, 160 apiece. Now they can double that. So that is double and then times 2, the number of them there. So the state in and of itself, 500 to 600, then 200 to 300 from us as the county and the county health system, and then more and more tests going out through our clinics and our hospitals and how they manage them as well. Personal protective equipment, PPE, and hospital capacity. We have 1.9 million units of PPE in our county. The burn rate shows that the hospitals have a 30-day supply of gloves, masks, gowns, and N95 respirators. We need to make sure that those are, by the county order, it states that those need to be in the hands of all the healthcare workers out there. We have had some unnerving discussions about some who said they have not been able to get those supplies, and we've seen even some strikes in certain areas. But where we look like it needs to go out, and we do have capacity. The healthcare support. Healthcare providers in the county have sent letters to support this attestation, confirming Dr. Mace, our health officer's findings, that we are ready to relax some of our restrictions and move more fully into phase 2, as I discussed. Those are letters from Petaluma and Hillsburg Hospital, and then the bigger 3, Sutter, St. Joe's, and Kaiser. So as I said before, we have some triggers for adjusting the modification. If the couple ones that are high level is that if the rate of cases increases to 4 out of every 10,000 individuals in our county, if the case fatality rate increases to 5%, it's currently at 1.1%. If community exposure cases increase to 30%, where it's currently at is 19%. And as I said, there's another 13 criteria that public health will monitor to ensure where we're at as a county and where we're going. But overall, I'm going to wrap it up by saying I hope everybody has a good Memorial Day weekend. I hope you enjoy our parks. I hope you enjoy your families. I hope you follow the orders. I'm asking you to follow the orders like I am, and to be a good citizen in these times. There are concerns abundant throughout our community, and there will be concerns as we are in uncharted waters. The business community needs certainty to be able to develop going forward. If you look at different sectors of our economy and our community, we've had surges in the Latino community that we've talked about. We've expanded testing into Latino neighborhoods in areas in strategic outreach. We need to do more. We need to get out. We need to make sure that as the opening up happens, that also the employers out there, the businesses are doing employee self-checks or having their employees do employee self-checks. And we got to make sure that people are following the mask guidance and other things. So please make sure that you are out in the community, make sure that you are holding yourself and others accountable, and make sure you're safe. Thank you so much. Have a good weekend.